listening to Teets and Ash, the show where two real-life providers get real about health habits, wellness, and the broken healthcare system. We're here to educate, empower, and entertain you. One appointment-free episode at a time. This is healthcare without the bullshit. Direct primary care. Another thing too is residency rates have gone down for primary care as well.
That's good.
So yeah, it's huge. So in 23-24, there was like a 1,272 unfilled physician residencies, leaving about 1.2 million
For primary care?
Primary care alone. Yeah.
Mm-hmm. Yeah. So think about that. So that means that many humans chose not to be primary care doctors. So that when in 4 years, when their training is over, that's how many primary care providers, doctors, we will not have in our bag of tricks.
And then think about this, about 40% of our current physicians are planning retirement over the next 5-10 years.
Right. Because
they're aging out.
Because they're aging out. And so we have this huge gap where nobody's coming in.
And all these guys are going out.
And guess what happens when you start going towards retirement? Your patient volume, you start dwindling it. You're like, yeah, no, I'm not seeing that.
And then guess where the patients go?
The emergency room, to the ER. The emergency room.
And that's the bad, that's what's so bad about going to the emergency room for primary care is you're actually taking up space for a person who's actually really, truly having an emergency.
That's true. But the other thing is a lot of patients, like when you're trying to get down to like, scenario emergently, and you're like, so what happened today that made you come to the emergency room today? And then they'll say, well, it's an emergency today. Every single time. Well, it's an emergency. This is my emergency. Me. I get it, but if you look at the definition of emergent and like your presentation, those do not add up. I mean,
so it really kind of pisses me off. I don't know if it pisses me off. I'm just,
girl, I've seen you. Yes, it does. So whenever you have patients, hair gets flying.
I get red. So whenever you have patients who check in and they're like, I have, I don't know, some basic ailment, and as an advanced practice provider in an ER setting, we have to go out, we have to greet you, we have to get the ball rolling. We're ordering labs, we're ordering radiology, we're ordering all these things, we're ordering medications that you can receive in the waiting room. We are working on you. We're actively working on you. And these patients go, I've been in this ER for 12 hours, and this person who just came in, you're doing impressions on him, but I was here first. And you're like, they have no pulse. And they get pissed off. But guess what?
Those patients,
you survived your fucking emergency, okay?
Those patients didn't.
That was really ugly, man. I'm getting on box.
Here we go. What I said. Those patients didn't see the emergency, right? They
do when we wheel them out of their freaking car and they're coming in. We're standing on the freaking stretcher doing compressions. We pull through the waiting room and they still come out. So say, when is it my turn? Did you just see what we did? What we were doing?
That 20 people, maybe, and out of those, only like 5 probably have the wherewithal and to understand that other people are sicker, right? So
it's not about first come, first serve.
It's acuity. Emergency is acuity.
And we're talking about emergency medicine again. I guess because people don't understand it. Well, because they're trying to bridge the gap between primary care and emergency medicine and not utilizing those resources.
Right. That makes sense. But yeah, no. Well, even in this scenario, like in primary care, if your appointment's at 10 a.m. and I walk in at 10:25, I promise you that for 25 minutes, I wasn't just, parking around there, hanging out. Like, I'm actively, I've probably room to room to room.
But we're pretty good about it here, honestly. Yeah. Our patients don't wait that long. No. People wait up to an hour, hour and a half, and a lot of physicians are. And I don't want to single out physicians. It's not just them. It's just any provider's office.
It's primary care.
Yeah, any primary care office, they can wait up to an hour, hour and a half to see the provider.
But they also...
And then they get 7 minutes with them.
But you also don't know what happened.
Right.
Or the patients before you.
And you would want the same kind of attention from your primary provider, right, that person just got before you in case you came in for something.
But the amount of emotional intelligence that takes to walk in, sit there for an hour, and then be, and you, because immediately I'm like, dude, I gotta pick my kid up. I gotta get this. I gotta do that. I gotta do that. Like, you know what I mean? Like, you have to run the gamut too, through your emotions, through all of it. But I know good and well that the physician in the back, or providers in the back, or PA, or nurse practitioner, or whatever, is not just stringing me along.
They're not sitting down.
They're not doing that. But even for me, when I've been sitting in an office for an hour, like, I gotta rein it in. Like, I'm like, okay, all right, so like, pull yourself together. Because we know that something must have happened. Or they got a brand new patient, a little meemaw that just brought a whole Crown Royal bag full of meds.
I love the Crown Royal bag of meds. It's my favorite.
And you got to go through all of them. Some of them are...
Half of them, the labels have
They're
chewed off. They've just been putting their new bottle in the old bottle. I don't know what.
So they got to go through that, and that takes forever.
Yeah, because you have to take every single medication.
Right.
How much is it? How long do you take it? Yeah, because for interactions and everything.
So that's why you say there is an emotional intelligence, that is required, and onus on the patient to understand as well. And our society is kind of a punch button society.
They are a punch, but the easy button.
We want it fast
Right now.
You said my appointment was at 10.
It is 10:03.
It's 10:20. Let's get it going.
Yeah.
Yeah. So but that's how everything goes. Like every other aspect. Like if you took your car, when you go to the 10-minute oil change,
It's not 10 minutes.
it might be once they get you in
there. Yeah.
But if they're 3 cars ahead of you, you got 30 minutes now.
Well, we no longer have waiting in America.
We do not wait in
America.
America.
We don't have nausea. We don't have pain.
You do not have pain.
We don't have waiting. What else do you not?
Americans cannot have pain.
Oh my God. And they can have nausea.
God forbid.
And they
Or
can't
diarrhea.
throw up. Oh, and they can have diarrhea.
Cannot have stools
It's incompatible with life.
for 12 hours.
No, absolutely not.
They have to take something, know something. Obviously, it's, sugar.
It's something. Yeah, they have to have a diagnosis for it. And that is another thing. Okay, I'm just going to say this. The younger generation has to have a diagnosis for every little thing. Mom, Brett and I felt dizzy for 6 seconds. What is it? I'm like, I don't know. Well, what could you diagnose me with? I don't know, child. Go drink some water. Poor kids. Every nurse's kid, go drink water. If you can't fill up your hand with blood, don't worry about it. What else?
Yeah, no, I mean, for mine,
Go lay down, take a nap.
if you haven't done, my whole family knows, like, if you haven't done the thing,
Yeah, if you haven't
that
done the
you
things-
know, when's the last time you had water? What time did you go to bed last night?
Did you take any Tylenol?
Did you take Tylenol? Ibuprofen? No.
What'd you do for yourself?
None of those things. What did you do for yourself before you involved me?
And that happens in the ER a lot too. Or even in primary care, they call you and say, "Hey, I've got a blood pressure of 180 over 110. Did you take your blood pressure medicine?" No, I wanted to call you about this.
I wanted you to see it.
Okay, I believe you. Or take
Fever.
blood pressure medicine. Yeah, oh, fevers and grand.
No, I didn't medicate them.
I
wanted you to believe me.
Yeah.
Dude, I believe you. If
Totally.
you tell me the patient had a fever of 103 before you got here, great.
Even if you tell me subjectively, I think I had a fever.
Right.
I felt hot, subjective fever. I believe you.
Whatever you said, it's not my metaphor.
I'm not going to argue with you.
Right?
It's how you
This
feel.
is your metaphor, right? So, yeah, no.
Yes, if you haven't done all of these things before you come to me,
Right.
as my child,
As my
or
child.
husband,
Oh, yeah, I gotta get that real bad.
then I'm going to look at you like,
Mine's not even medical.
mine is medical, but he will tell you. He will do the things.
Imagine being mine and not even knowing the things. And then my snarkiness, and well, on top of that, think healthcare providing alone. Like, I have literally listened for 12 hours about everybody.
Everybody's complaints.
Unfortunately for our families, like when we get home, like I'm almost tapped out. Like,
Oh, for sure.
I really have enough to give to My goal is to not destroy my child by my lack of empathy, sympathy, and ability to have a conversation or any of those things in that little bit of time frame that I get with him afterwards. So an adult, no, we're going to cuss you out. Do not, you know, because you can take it. Yeah. The little one can't. That's a true story. So he gets a lot.
So we're making thousands of micro decisions every single day, big decisions, little decisions. We're hearing every single person complain. So when I get home, I don't want to hear about what went wrong with your day. I want you to say, "Oh, I'm so happy you're home. Come sit down."
I do. But then again, I think about that. That's unfair, right?
No, it is.
It's because
Unless when children complain,
it's still unfair. Because they got problems too. The adults have problems too. And this isn't, I'm not egocentrical.
I'm not.
It's not all
Just
about
give me a minute to walk in the door. But I'm talking when I walk in the door, and the first thing out of your mouth is, "We got to get this out of the other because this, that, and the other broken. I need all these things." Or I don't feel good. I haven't felt good all day. I'm so tired. I'm so tired. I'm like, my favorite thing was this is another thing too.
Lance Reese loved that.
You know who loves this thing? He don't even know what hashtag is.
He knows that one.
Does he?
Oh, it's hilarious.
Okay. So another one was when people and I. Do you see where we are? Do you see where we are? You see what we're doing?
Well, a good thing. So that's another huge difference between emergency and primary care. Emergency, everyone's having the worst day of their lives in their lives. Primary care, a lot of people, the humans are so different. Mm-hmm. Like they are happier, thankful,
very thankful.
They're like, thanks for talking to me. This, that, and the other. It is such a different breed of humans. They're necessarily happy, or don't feel well. Right. Yeah. So nobody is in good places when they don't feel well. But the emergency room,
it's like the worst of the worst every single day.
Excited to be there. Right. So all of the patients you've seen all day long are having in what they consider an emergency. And in the primary care, you do get, I tried that medicine you told me, and I feel so much better. And it's like,
we don't need to see that. And that you
never see that.
Ever. We don't need to see the fruition of our effort.
They call you, and they're like, hey, I called those people you told me to follow up with. It really helped. And I'm like, oh, my God, it's so nice. It's so nice result. Just a little bit. It's like a little silver lining of healthcare.
Even when you admit them to the hospital because they need to go to ICU for
whatever.
Yeah, that's all you know.
Unless you call them back and then,
But who has time for that?
A lot of times sometimes if it's a real bad scenario, I try. But truthfully, I'll write their number down. A lot of times, life happens to me and I forget until something triggers my brain. And then I'm like, and then, and then what if you call one time and they're still admitted? And then you feel really weird, like, what do you do with this? It's a whole thing. So, yeah, you don't get to see that.
You don't. But in primary care, you do.
You do.
Call up and you see them.
And I love it when patients are in primary care. Like, I was admitted and I was told to follow up. I'm like, oh,
I can't believe you followed up.
I'm so happy that you're here.
I really am. Because
I want to know. I want to know all those things. I want to know what happened. I want to know what they thought.
I think that's a lot of the difference, too, between a direct primary care and a primary care. Yes, they can follow up with their primary, but we have a little bit more time to spend with our patients, too, so we can fix foundational issues so that they can be healthier humans.